Hi, my name is Sarah Barrett. I am the Medical Training and Support Director for Research and Response, a section within the North Dakota Department of Health. Today, we are going to be discussing the medical collection model for BinaxNOW test kits. There are two models for BinaxNOW collection. One is an asymptomatic screening model, and there is another video that explains that process. And then this one again is going to be the medical model. The difference between the two is the asymptomatic screening model is a model developed to decrease the use of PPE within the stores that we have, the limited stores that we have because of COVID, and also to make COVID testing more broadly available to the community. The asymptomatic screening model, as you can infer, is for asymptomatic individuals only. The medical model is available for both asymptomatic and symptomatic individuals because it's performed by a medically trained individual, and it would be individuals who have been approved within their licensure to perform PCR tests. And the medically trained individuals would also need to be in full PPE, the same PPE that you would be using for a PCR test. That would include eye protection, so either goggles or a face mask, an N95 respirator, gown, and gloves. Please remember that all COVID-19 tests must be reported to the North Dakota Department of Disease Control. And one process to be able to report COVID-19 test results is through an app called Power Apps, or also known as Dynamics. In order to use Power Apps or Dynamics, after you've been given your licensure from NDIT, they will also give you a hyperlink and a QR code. Every individual coming to test within that location will have had to use that specific QR code and that specific hyperlink to be able to test for your location. If this is a location supported by the Department of Health and is staffed by Department of Health individuals, medical professionals, then the generic testreg.nd.gov hyperlink or website is still the website for individuals to register at. But please note that there are limitations. If you are a facility that's been given a specific QR code and a specific website for individuals to register at, if somebody registers at the testreg.nd.gov website, you will not be able to visualize them within your system. There is a video that will have been provided to you by NDIT or your BinaxNOW liaison that explains the registration and the reporting process within Power Apps for BinaxNOW. The day of your event, after somebody has registered, they would come up to a registration table, and at that table, your facilitator would ask for their name and date of birth, search for that name and date of birth within Power Apps, and also write that information on a label. You would link that Binax test card within Power Apps to that specific individual, and then you would give that test card to the individual who's being tested. They would then take that card back to the location where the testing is occurring. And remember that that swabbing location needs to be a minimum of 6 feet away from the registration table or 6 feet away from where anybody else is standing, having specimen collections being done. Really, we need to be conscious and aware that that 6 feet minimum distance is being maintained for infection control. So the medical professional then, within full PPE, will place 6 drops of reagent into the smaller top hole of the BinaxNOW card at the location of swabbing. They will then have the option of collecting the specimen by circling each nair 5 seconds with the sponged end of the swab, or they may choose to train the individual how to collect their own specimen in that moment. To do that, they would need to first verbally and visually demonstrate how to perform the swab collection. That would include communication of, I'll open the swab for you, and with the sponge end of the swab, you would rotate it in your nose 5 seconds on one side and then 5 seconds on the other side. Once that's complete, I'll take the swab from you. But once the specimen has been collected, the swab would be given back to the medical professional. They would then insert the swab into the larger bottom hole of the Binax card, pushing it towards the top of the card until it's visible in the smaller hole, rotating it clockwise 3 times, leaving the swab within the card, remove the adhesive protector, seal the card up, write the time of collection on the label, and then place that card carefully within a Ziploc bag, ensuring that it's remaining flat at all times. The test should then be carefully removed to a resulting table. As you're moving that card, ensure that it is remaining flat at all times. We really encourage that your resulting table is separate from your locations of collection to provide privacy and protect people's information, because it is quite easy to see names and results within these test cards. So we really encourage, again, that it is a separate location. The facilitator who would be reading the results for the BinaxNOW test kits would need to read those results within 15 to 30 minutes of collection. So 15 minutes after the time of collection and before 30 minutes after the time of collection is the time allowed for reading the BinaxNOW test kits. If it is a busy location and you're unable to record results of those test kits within Dynamics within that time frame, it is very acceptable to note on the outside of the bag the results of that specific test within the 15-minute time frame of reading. When you are able, and as soon as possible, because this is how individuals will get their test results, it is important to record those results within Dynamics. And again, there's an instructional video of how to record results in Dynamics. The most important things that I can communicate at this time is the importance of keeping 6 feet distance of all of your locations, of within waiting in line, maintain social distancing. Encourage everybody who's coming to your site to wear masks for the event. I would encourage, if possible, to keep asymptomatic and symptomatic individuals separate, even while waiting in line. Again, anybody doing specimen collection must be in the proper PPE, which by the CDC for an aerosolizing procedure includes eye protection, being face mask or goggles, a respirator, an N95 fit tested respirator, gown, and gloves. In between each individual, please change your gloves. Please perform hand sanitizing between each individual and new gloves each time. If you have any questions, please reach out to your Binax liaison, or you're always welcome to email me as well. Thank you.